Today's topic is the recruitment of participants. It's probably fair to say that there's very, very little in today's unit that hasn't at least been touched upon in other units. For example, risks and benefits in study design, informed consent, cultural competence. And yet there's a very good reason why we're addressing this as an applied topic that illustrates all these issues. And that's to be found in the history of human subjects research. If we look at the Nuremberg trials in the Nazi experiments, or the Tuskegee syphilis trial, the Willowbrook experiments, in each case the participants came from vulnerable groups, whether these were people living in concentration camps, poor African American men, or institutionalized children. These groups were not able to represent their rights adequately. On the other hand, we see that sometimes groups are unfairly excluded rather than targeted. For a long time, women were systematically excluded from clinical trials, and this led to harms because drug research that involved only men didn't take into account the possibility of side effects that might arise only with women. And this leads us to safety issues also in the recruitment process.
Yeah, I think that safety is a key issue in recruitment. As the scientist develops both their inclusion and their exclusion criteria, they really need to be sensitive to different groups and also individual needs of people related to the experiment. So for an example, if in a drug trial, if it creates a high blood pressure, you would want to be careful to screen out people that may have high blood pressure problems. So I think it's key to be sensitive to. Of course, that means that you have to understand these diverse populations, which requires other research, including people of color and women, to see what their different needs are. I think that a second issue that's applied to recruitment is the marketing and advertising, and that's where our discussion group had a lot to say about what motivated them to participate in research and how they learned about research projects. And I think this is really something new, that as we move from a science that really utilized disempowered people in experiments to one that makes an effort to bring people into a study through their volunteerism, is that there has been a real marketing effort within science itself.
And yet this marketing effort, as we will see, also raises challenges in the enrollment process, especially at the level of informed consent. Our interview today is with Dr. Diane Scott Jones. Dr. Scott Jones is a professor of psychology at Boston College, and she served for several years as a member of the National Bioethics Advisory Committee. She also has written an important chapter on the recruitment of participants for a book published by the American Psychological Association. I began our interview by asking Dr. Scott Jones why she viewed the issue of participant recruitment as an ethical issue and not merely a technical aspect of science.
The recruitment of participants for research is, of course, a technical issue. Researchers need to recruit a certain number of participants for their study. Researchers would typically conduct a power analysis that would tell them how many participants at minimum are needed for a study. Researchers also would need to have a representative sample. They would need to select people that are representative of the population to which they would hope to generalize. So there are definite technical issues that must be addressed. There are, in addition, ethical issues that come into play because the people who are being studied are people. You enter into a relationship with them as people. As in any human relationship, ethical issues come into play. The ethical issues that we've identified that undergird our system of protections of human participants are beneficence, justice, and respect for persons. These three ethical principles guide the researcher as he or she goes about recruiting participants for a study.
When the Belmont Report discusses the principle of justice, it specifically applies it to the subject of participant recruitment. How is justice related to the recruitment of participants?
The Belmont report tells us that we shouldn't target groups of people for research simply because those groups are easily accessible or easily manipulated. We should target groups because of the scientific questions the study poses. The Belmont report names groups or classes of people that might be especially vulnerable to being manipulated. They mention racial or ethnic minorities, welfare patients, people who are institutionalized. So the Belmont report tells us to target participants not because we can easily control them, but because of a scientific reason. On the other hand, we also should be mindful that as we shouldn't target people unfairly for risky research, we also shouldn't exclude people from research that might be beneficial. This exclusion has scientific implications as well as ethical implications. There would be gaps in our knowledge if we didn't have a broad range of people participating in research.
And of course, institutional review boards were created largely in response to the Tuskegee syphilis trial. Can you give me some examples of research studies in which the recruitment of participants has given rise to serious ethical concerns, even in this age of IRB protections?
One study that many people consider unethical because of the manner in which the participants were recruited is a study of fenfluramine. This study was done with the younger brothers of convicted juvenile delinquents. The younger brothers were identified through court records, sealed court records in Manhattan and in the Bronx. Choosing this location, of course, meant that almost certainly the delinquents and their younger brothers would be African American and Latino, and that was the case in this study. The parents were asked to give permission for the boys to participate in the study, but the full implications of the study were probably not a part of the recruitment process. The researchers had in mind identifying a genetic link to violence in these studies, and the fenfluramine challenge studies involve assessing levels of serotonin, which are then indirectly linked to the possibility of aggression in these younger brothers. Many people consider this study unethical and specifically unjust because there was no reason to target these younger brothers. They had no criterion that would have brought them to the attention of researchers interested in aggression already expressed in children.
Sometimes participants are offered cash to enroll in a study. Some people argue that it's simply reimbursing them for costs to remove obstacles to participation. Others say that it could be coercive, that the people need the money or it's a very high sum. What do you think of this practice? Do you think it raises ethical issues?
The issue of coercion when there is a payment for participation in research is one that needs to be addressed more fully. You can think about situations in which the payment is coercive, even though it may not be intended to be. The key issue is whether the potential participant is shifted away from thinking about the research and what the participation would involve, what the goals of the study are, to thinking about how much money can be earned for participating in research. So coercion can occur even without the researcher intending it. The Belmont report makes a clear distinction between coercion and undue influence. Coercion involves an overt threat of harm or an overt clear loss. Undue influence, which is also unacceptable, means that the person is changed in his or her thinking about research participation in a way that removes the choice. The moment you remove choice from an individual, you've violated the principle of respect for persons, and the person is no longer freely choosing to be in the research. The person is no longer a volunteer, but is a paid participant.
What are some ways that a participant's focus might be shifted from the research project to the financial incentive that's being offered?
One of the considerations for the researcher is the income level of the population being studied. I can recall an instance when I was sitting in my office and a father and son walked by, they were looking for a study that would pay them $15. They didn't remember what the study was about. They didn't remember the name of the researcher. They only remembered that they would get $15 if they took part in the study. But even when participants are not low income and in need of even a small amount of money, there can be undue influence or coercion. One of my students showed me a flyer that she got that was posted over her ATM machine. She saw it when she was taking out some cash from her account. This flyer advertised a sleep study that would give participants $1,000 a week for up to 10 weeks. Of course, she was attracted by the possibility of earning $10,000. It's that kind of shifting of focus away from the study and whether you would volunteer for the study to thinking about, I need $10,000. It would really help me out a lot. So there are even instances in which websites are devoted to helping participants find ways to make money by participating in studies. These websites are called pre-recruitment devices because they first and foremost get the person focused on earning money through participating in research. They then connect the person to a variety of studies, and these websites even advise potential participants on ways that they can make themselves maximally eligible for a variety of studies. They even advise participants on what to do to build up the iron level in their blood if they want to participate in several studies that require blood draws. So it's pretty clear that the focus is being shifted away from the study itself to the payment that's possible. There are other websites, however, that do focus more legitimately on the studies. For example, the National Institutes of Health have an online publication called the NIH Reporter that does list many studies that are available. They do often mention that compensation will be provided, but they don't tend to highlight the dollar amount. Only in a few instances in the last year have I seen advertisements that focus on the dollar amount.
Does it make a difference who is doing the recruiting?
The person who does the recruiting has an important job. That person must be able to be successful in enrolling the potential participants in the study. A safeguard that we have to institute is that the person shouldn't exert undue influence over the potential participants. So for example, if a physician is recruiting patients, that might create a situation of undue influence because patients look up to the physician and rely on the physician's judgment. If the person is a highly regarded member of the community, that person might exert undue influence because people in the community would have learned to rely on that person and would trust that person's judgment. So we need to be aware that recruiters might exert undue influence. Another element is whether the recruiter is paid for enrolling participants. So that creates another layer of influence if the person is paid, and there would need to be safeguards to ensure that the person isn't aggressively recruiting simply to get more money.
There are groups of potential participants of research that might find it more difficult to decline participation. What are some examples of these groups, and should they still be invited to participate in research?
Some of the groups that might be especially vulnerable are groups such as prisoners, children and adolescents, students, undergraduate students who take part in their department's subject pools. These are groups of people who may be influenced unduly by persons who have a position of authority in relationship to them. To take children, for an example, children and adolescents are accustomed to being obedient to adults, that is most of the time. So if they're asked to participate in a study, they may not think they have an option of saying no. They may think that they're expected to say yes. Therefore, recruitment for children is directed toward their parents. The parents are asked whether the child can participate in the study, and the child is asked at a later point after the parents have given consent. This works well, except in the case of adolescents, we have a little bit of a dilemma because many adolescents are able to make decisions for themselves. They would be able to think through whether participating in research would be problematic for them. And there may be studies of issues that are important health issues, such as adolescent sexual behavior, that might not be undertaken if we had to rely on parental consent for those studies. So we are now thinking about whether adolescents should be treated differently from children. The rule now is that if the person is younger than the age of majority, then recruitment is directed toward the parents and not to the adolescent or the child.
When is it a good idea to approach a community member or a leader within a social group during this process of recruitment or in designing your recruitment procedures?
Researchers often benefit by consulting with community members when they're undertaking a study. For many issues that are of importance to researchers, there are groups of people who would identify themselves as a community. For example, in the study of AIDS or HIV, people who have that disease or people who care for those who have the disease think of themselves as a community. So researchers might consult with people from that community in deciding how to go about recruiting. They may even enlist the support of members of that community as they go about the process of recruiting. Researchers can give information that would be helpful to the community and may garner support for the research they're undertaking. Researchers also can learn a lot by talking with people who are from the community of participants. They may learn what's important to that community. They may learn some information that could actually help them with the scientific development of their work, in addition to getting help with recruitment.
Sometimes people go beyond merely consulting community members, but get them involved in the recruiting process. They might ask them to play the role of recruiting others, possibly even to assist in the gathering of data. Do you think that these community members then should be given some training in this regard? And if so, what should we really focus on?
The training of recruiters is very important. The recruiters who actually speak to the potential participants are the link between the scientific aspect of the study and the actual implementation of the study. It's very important not to disconnect those. So we wouldn't want a situation to occur in which a researcher doesn't have a clear understanding of what the recruiters are doing. The researcher is responsible for the training of recruiters, as the researcher is responsible for the training of the entire research staff. So that training would consist of a good understanding of the ethical principles that we use. That training should include information about when we accept no and when we find it acceptable to be a little bit persuasive if someone is hesitant about becoming involved in the study. The training should probably be ongoing so that recruiters get some feedback as they go about their jobs. So it wouldn't be a one-session training, but training that would be spread throughout the recruitment process so that there's good feedback between the researchers who designed the study and the recruiters who are going out and actually meeting the potential participants.
Drawing from your years of experience conducting and reviewing research, what recommendations would you have regarding how we can improve the process of recruiting participants?
Education is important. Researchers, when they're beginning their careers, should learn how to go about this process in an ethical way, as well as in a way that's scientifically sound. The education doesn't end with new researchers. Experienced researchers should revisit these issues and should refresh their ideas of what it means to recruit a sample ethically. And where possible, communities of potential participants should be educated about their rights and about their involvement in the process of research. So this education is something that's continuing and ongoing, and what we should keep foremost in our minds is that the rights and the welfare of the potential participants and the actual participants are very important, and they're of equal importance to the scientific goals of the study. In the end, science should serve society, so we should make sure that what we do as researchers beginning the process of recruitment and implementing the process of recruitment is fair and just to the people who should be the ultimate beneficiaries of the research.
Well, Jean, Dr. Scott Jones is certainly right. We need education in this area, but not merely formal education, but often just informal ways of raising awareness of different issues. One of the things that's important to point out is that we never do ethics in a vacuum, but always in a context. And we spoke a little bit about the historical context of recruiting participants. But it's important to focus on other issues as well, the context of poverty here in the United States, holes in insurance coverage, or the fact that many people still don't have access to adequate health care. And another very important contextual issue here, at least for clinical trials, is the sheer cost of bringing a new drug to market. So I'm told pharmaceutical companies now are investing about $500 million prior to seeing the drug to market. So naturally they're eager to see these drugs on the market being sold, but this can only be done quickly by enrolling participants quickly.
I think that's why there's always been an emphasis on getting people into a study, that's really been seen as key, and to look at the ethical issues involved with getting their consent and getting them into the study. However, when you look from the perspective of a research participant, you also have to consider how you can enable someone to decline participation, to be able to say no to participating. And I think this emphasis on recruitment and getting the numbers up in a study really can lead researchers down a road where they begin to, I think, apply undue influence on people to stay in a study and make it hard for them to say no. For example, multiple contacts with a participant through letters and postcards and maybe telephone calls can be seen as forcing or trying to influence a person to participate. And even though they may passively decline, like throwing postcards in the trash, I think that a researcher has to be sensitive to how much can be too much for someone. And I think also that the tendency to train recruiters to be effective recruiters also involves selling the research project and really applying pressure to the individual by actually training people to have a more aggressive presentation, so it is harder for people to say no. And then also there's this pressure on recruiters that their job performance is evaluated by how well they keep up their recruitment numbers. So I think in the end, though, the greatest motivator toward participating in research is money, which is what our discussion group indicated. You said that two of the reasons that you participated in research, one was to help other people, to make a contribution to society, and the second reason is that you got some reimbursement for your participation. Would other people here agree with him? Yeah. So how many people here did it to help society? Participated in research to help society?
I did it to help society plus the compensation of it too.
Well, I was going to ask that. How many people here participated in research for the compensation that you got? For the money that you were paid?
Just for the money, no.
No, not just for the money. It had to have some other benefit.
Intrinsic.
Yeah.
Being honest, the money
Intrinsic
wasn't
benefit
advertised.
would be helping society.
Altruistic.
Altruistic benefit.
Money will entice you to participate, even if you don't even want it. Even if you want no cause.
Right.
Money will make you participate.
And then once you get involved in the study, you might see the merits of the study, you know.
Has anyone ever seen ads in the newspaper?
Sure.
Yeah.
As in the news.
Have you responded and said, I want to be a subject?
There was an ad in Riverfront Times saying research for 10 weeks, $10,000. Now that's like, where I'm going like, yeah, I want that, So I looked it up on the internet, and it's saying research for safe sex, research for alcohol, pot. I mean, they have research on almost every category, sperm, almost everything. Well, it was the money so much as that, you know, you want to grab at the money, you know, regardless of the, and then it said safe sex, so, you know, guys, you know, we, I'm just being honest.
The first research I did was, well, I picked up one of the college newspapers because the first one I ever did was a one ad in the back of the college paper. For students, it was good money. And I see them all the time in student papers. People with a mental illness tend to have monetary problems because of their work histories.
People that have good paying jobs and a great medical health care plan don't go into studies normally. It's people, there's a pressure because you need the money or the care or whatever, and there's an attitude. I once went to a study for sleep study, and I changed my mind, or I didn't do it, and then I called back to try and get back in because I really needed the money. And she said no, which is her right, but you know, she wanted me to mail back the parking tokens to the hospital because that was really important to her. And we talk about the people being studied get paid. Well, the people doing the study get paid. There's no one volunteering to answer questions. I mean, ask questions. And so there's attitude of respect.
I say it's not just the money, it's the knowledge of learning what's going on. You know, we need to know it's not just the money, you know, it's the knowledge.
Well, Jim, they all mention doing it for the money, but not one of them thought it was wrong. We all live in a capitalist society, so what's wrong with doing it for the money? To be devil's advocate, I would say, who says you have to do research for altruistic reasons?
Well, Gene, that's in many ways a shocking question for me. I sit on a couple of IRBs, and typically I'm used to IRB members objecting when a researcher offers money that appears to be an inducement to participation. They'll say it's okay to cover transportation costs or babysitting costs, but you're trying to unduly influence them. And so it's a good question you're asking.
Well, I think that response ignores research participants as collaborators or as co-researchers and the necessity to pay them for their time, for the information that they're providing.
Well, and one of the participants really raised that as an issue of fairness. You know, he pointed out that the researchers being paid, no one asks questions on a voluntary basis. Yeah. Why should we expect someone to answer them for nothing? So it's a good question. I think, you know, for minimal risk research, perhaps it's not a problem if someone goes into it for the money and the researcher is aware of that. But when research involves greater than minimal risks and there's a risk that the money might cloud their judgment, I think then we have a real problem. Then we're looking again at the risk of exploiting the poor or other vulnerable groups as our guinea pigs to take risks that we wouldn't take on ourselves. But perhaps, you know, you're really pushing us to think this afresh and to say if risks are the problem, maybe we need to reevaluate those separately and say, are these unreasonable risks? Or if undue influence is the problem, maybe we need to assess that in the context of assessing decision-making capacity and do it on a case-by-case basis. And if someone's ignoring risks and can't paraphrase them for you and shows no understanding of them because they're too focused on the financial incentive, then you address it that way and say they're clearly not showing appreciation of information, rather than penalizing an entire group of participants by denying them reasonable compensation.
And also, I think it recognizes the context in which research is done, as long as people with psychiatric problems belong to the lowest tier of society and are poor, that we have to take in those considerations. But money inherently is not a problem or an issue for science.
Well, Jean, again, perhaps what we've done in this session is raise awareness of issues, even though there aren't always clear answers to them.
And I think that involving the perspective of participants from our discussion group has really provoked us to think about these issues in a new way.